So thank you for your question. So hysteroscopy is a procedure that we perform to assess the inside of the womb cavity. So basically, it is done with a small telescopic camera, which helps us to have a look inside the womb cavity properly. Now, you will do this procedure if there are concerns, usually with irregular bleeding, and more commonly with women who have gone through the menopause and they are having bleeding. Therefore, we need to make sure there's nothing sinister behind the bleeding. So that's one of the common reasons why we do hysteroscopy. But it can be done in other situations, especially women that have not been through the change, that have noticed a difference in their bleeding pattern, and also, it might be an assessment of the womb cavity for women that are going through fertility investigations. So, hysteroscopy can be done two ways. One is asleep, where the woman doesn't feel anything at all. Also, it can be done awake in the gynae clinic. This is where some women can feel pain. Now, the what women feel varies, and some people describe it as a discomfort, not anything worse than a period. But for some people, it is a bit uncomfortable, but yet they're able to cope with the procedure. And very few women on having hysteroscopy awake would prefer not to have the procedure done awake because they find it very uncomfortable. So it varies amongst women, but from my experience, most women do have it done awake. However, we do advise that, they have some simple painkillers at least an hour before coming for the procedure. And during the procedure, having somebody to talk to, like the nurses holding their hands, helps to help them to get through the procedure very well. It is a short procedure and lasts usually about 5 to 10 minutes. So a lot of women are able to cope within this period to have the procedure. So the reason why we do hysteroscopy is to assess the womb cavity. And this could have been because of irregular bleeding that we discussed, or also it could be because of ultrasound scan showing the thickening of the lining of the womb, which could be a sign of a polyp, which is like a little skin tag on the lining of the womb. So you can use hysteroscopy to confirm what the scan suggests. And if there's a polyp, you can remove the polyp at the same time. If there's any thickening, you're able to assess properly. And after the assessment, you take biopsy from there. Also, you can use hysteroscopy to find lost IUCD or coil after insertion, so you can remove it directly. And also, there are some procedures that you can do with hysteroscopy, especially for women undergoing fertility investigation. So usually when it's done awake, the risk of any serious complication, it's very, very, very low. And the reason being the patient is awake, therefore it limits how much you can do, especially when they start experiencing pain. But commonly, especially when women are put to sleep, we say risk would include a bit of crampy pain. There might be some watery bleeding afterwards, which is only for a couple of days. Infection is not so common that they require antibiotics, but something we look out for and we'll treat it. But in terms of serious complication, you're talking about injury to the womb in form of a perforation, and rarely would that go beyond that to affect things around, like the bowel, bladder, or major blood vessel. It's only in those situations that you might need to do additional procedure, either surgery to have a look inside the womb, and rarely would you cut the woman open to address the complication. But like I said, these complications are quite rare. So going back to where it's been done, if it's done awake, usually you'll be given a time to come into the hospital, and the procedure itself from the start to finish, usually less than half an hour, and then you're able to go home on the same day. Because of the general anesthetic, we say recovery takes about a day or two. Okay. But if you're having the procedure done awake, recovery doesn't take long at all. Usually after the procedure, you're able to go back to your normal activities. You might require painkillers depending on how uncomfortable the procedure has been. And in terms of having it done awake, it's usually good to either speak to people that have had the procedure done, or you might even want to come with somebody to support you during the procedure. And most importantly, it might be a good idea to take simple painkillers like 2 paracetamol with ibuprofen if you can, at least an hour before the procedure.